Good morning. I am so excited to be here. I want to thank John and the Chris Ed team for asking me to speak. I am so glad that we're all back in one big room together. I think that part of it all by itself is super exciting. I am so honored to get to speak amongst so many great leaders within our profession. But I would also say that I am very grateful to work for a company, and I am very grateful to Justin for the opportunity to work in the organization that I do that promotes people, that promotes processes and great care, and knowing that efficient care and phenomenal care go hand in hand. It doesn't mean that we're going faster, as Leslie was saying. It means that we're going to be efficient, and we're happier when we're efficient. So we're going to talk about getting the hygiene department that you want. A little bit about me. I have been in dentistry for about 24 years. I'm so grateful that I have had an opportunity to work not just as a hygienist, but I've been an office manager, I've been a treatment coordinator, I was an assistant before I went to hygiene school, and I understand the extremely important role that every single person brings to the practice. We could not do it without every single person doing and being what they are. I am currently serving on the University of Houston Customer Service panel, and I think that that goes hand in hand. Justin has a saying that we are in customer service business, we just happen to be doing dentistry, and that is so, so true. I'm currently serving as the Colgate ambassador. I do love Colgate, just my own little plug, I guess. But I also write for Colgate on the professional and on the consumer side of care. So let's talk about why do we do assisted hygiene? You know, I think that sometimes people think, I'm gonna get more money, I'm gonna be able to see more patients, but why are we actually doing it? You know, I think sometimes hygienists see it as having an assistant means they get to do less, and that's not necessarily true. You know, we work collectively so that we can carry out better care to all of our patients. But is it because we want to have more availability? If you open up more columns. Assisted hygiene is designed so that the team can provide efficient care. The hygienist can give the best care within their scope of practice, and our assistants can then do what they do within their scope of practice. It's not a matter of a lazy hygienist. It's about supporting an assistant so that they can do things that's within their scope of practice too. Before you decide if this is what you want to do, there are a lot of things that you need to understand though. And I don't want you to leave from this conference and think, okay, this is what we're going to do, and just immediately you think you're gonna make it happen. Because there must be processes that put together in order for us to do what needs to be done. Because if you do not put those processes together, you're going to fail. You're going to have really upset team members, and that's not good for anybody. It's not created to just be easier. You're not just trying to give more appointments. We're literally wanting to make sure that we're providing good care, but people are able to benefit at a greater capacity. And if you don't do it properly though, you are going to end up in basically a prophy mill. And no one wants to have that. You don't want that reputation, and you definitely don't want to put that out as if that's what you are. And you don't want your people to feel that that's what you're doing. So I want you to think about where you're gonna start. How many of you, when you think about making your Thanksgiving dinner, you think about all the preparation that has to go into place for that Thanksgiving dinner, right? You don't just wake up on Thanksgiving morning and all of a sudden, everything is just there. And if you do, then please let me know how you do that, because it sounds like a much better way of doing it than what I have to do. But I want you to think, you gotta make a menu. You're going to the grocery store. I mean, heck, I don't cook the Thanksgiving turkey. My husband does it, thank God. But if, I know it has to sit out for a couple of days, right? Or at least has to come out of the freezer. So there's gotta be some preparation in it. You gotta make a plan. So I want us to look at just these little things. You gotta have good resources. You gotta have good preparation. There have to be processes put into place. You need good people. Your people should be your most important resource. and you have to set clear expectations. If you do not set good, clear expectations, it is not your people's fault if we can't get it right. It's your fault because you did not set the expectation of what needed to be done. You've got to make sure, as we think about resources, we use, I think, some of the best resources in our practice. You need to make sure that you can do with what you want to do. You got to have the stuff in order to do it. We go through a lot of systems, I guess you would say. We have lots of things prepared throughout all of what you're seeing on the screen, down to we prepare our headrest cover with everything that needs to go inside for a prophy. Now that may seem kind of silly, but how many of us, hygienists, you get ready to do your polishing, but you don't have a prophy angle out. You don't have a prophy paste out. You don't have your floss. Those little things make a huge difference. And so we make sure to go ahead and put all of those things together. I want you to make sure you've got good, sharp instruments. How many hygienists do we actually have here with us? And Justin was not kidding. This is like blinding. How many hygienists do we have in the room? Raise your hand. All right. How many of you feel like when it comes to using good instruments, your bosses may have to close their eyes for just a moment, but how many of you feel that it's so frustrating to get ready to try to clean teeth and you're using butter knives and trying to cut a ribeye? Won't work. You can't have efficient care if you don't have the resources to do it. So we use American Eagle XP Quick Tip instruments. And I have 5 sets that I'm going to give out to some hygienists today. It's my favorite instrument. It is an amazing instrument. Docs, if you are getting ready to buy resources for your team, I would highly suggest these instruments. And the reason I love them, nothing is worse than breaking the tip of your favorite instrument. The other end is great, but this one's broken. So now I don't want to waste this tip, but I've got to keep this broken one in my mix. And then I've got to have another one that I'm going to put in the mix. So now I've got 2 broken-ended instruments. That's not efficient. What's that? It's American Eagle. And if you would like, I would love to give you one. And then that way you've got the complete thing for yourself. So it's a handle. You've got 2 tips. They actually wrench on. The great part about that is if one of those tips breaks, I take it off and put a new one on. It's not any more expensive. And here's the best part. You don't sharpen them. I can't believe you actually didn't clap louder for that. Nobody likes to sharpen. I hate sharpening. And when you work in a practice with lots of hygienists, how many of you have curettes that become sickles? It happens. This is a great way for you to maximize what's actually going on. I'm a huge, huge fan. You need to make sure that you have a handpiece in every single room. That's important. Do not have things to where you're skipping things around or you're having to move it from room to room. We have all of our rooms in all of our offices can do the exact same thing. And we can do any type of dentistry in any of our rooms. But we do have rooms that are specifically designed for us to do hygiene in, right? When you think about having that room, if I have to take a handpiece off to polish in this room, take it off, go to the next one. Take it off, go to the next one. And I know that OSHA, the big thing that came out that says that you need to make sure and sterilize after every single patient. I'm sorry, that is absolutely ludicrous. It is not possible. I don't take off my entire ultrasonic, my Cavitron wand every single time. We just wipe it down, right? Put a barrier on it. It's not a big deal. But you need to make sure that you've got one in every single room. And when you think about how many packs of instruments that you need, think about a day's worth. How many instruments, because the more that you may have 5. But if you're having to run those 5 packs through the autoclave more and more and more, it doesn't do you a whole lot of good to only have 5 because they're gonna wear out faster. Make sure that you have prepared your team with enough resources so that they can do and they can have what they need to do their job. You heard me say that we have, every single room is set up the same way. We have our ultrasonic scalers on our delivery system. We add ultrasonic scalers, Cavitron inserts, whatever you want to call them, but we add those every quarter for our team. We order enough. I would encourage you, specifically, we use Dentsply. I can give you some information on that. If you want to know specifically how to get a good deal, I can tell you because I love to, bat my eyes a little bit if that's what I need to do in order to get what I need to get in order for us to have more for a longer period of time. But most definitely work out something with your dealer so that you can have those resources. So this is specifically whenever you were asking me which one they are. It's American Eagle XP instruments. We use ProfiPal handpieces. The warranty on the ProfiPal handpiece is 2 years. And these people do not represent me. I'm just telling you through our trial and error, these are the things that have been phenomenal. But the ProfiPal handpiece, it does have a 2-year warranty, and they completely will replace these handpieces. Chris, out with Darby, can tell you, I have unfortunately had to send him those serial numbers many times, and we send that handpiece off, they send it right back completely fixed, no questions asked. And some of the times, I cannot believe that they would actually replace it, but they do. And then I said we use Dentsply ultrasonic inserts. So, Travis, can you come grab these for me? Travis is going to, we're going to hand something out on this side, and we're gonna also hand some other stuff out. And I'm gonna be passing back some Starburst. And I want everyone to take a Starburst. You're gonna pick the color that you like, whatever flavor, whatever. And then we're gonna be talking about that, but I want us to go ahead. It's in that white bag. So when you think about your processes, you have to have a good schedule. You need to know your no-show rate. Do you remember Justin was saying yesterday, we typically know our no-show rate prior to COVID was 30 to 35%. We knew we were gonna overbook and schedule 3 columns of hygiene for every single one of our hygienists because we knew we were gonna not have someone show up. Since COVID has happened, we're at like a 45 to 47% no-show or cancellation rate. We can't control if they're gonna come in. We prepare, and I sure hope that things are ready to go, but sometimes you're gonna have to overbook to actually see what you want to see. Patients have shown us they're not going to show up. They don't just tell us, they're showing us. So we need to ensure that we're prepared to go ahead and do what we need to do. If you want to see 2, so if you want your hygienist seeing 2, you need to schedule 3 patients. And I know as a hygienist, if I were to look at some of our schedules at the very beginning of the morning, and I look at them, and I'm confident, I know what I can do, and I know how I can take care of these patients, but I am not kidding. There are times that I'm just like, but it's only color on a screen until those people walk into our office. So there's no reason to panic. We're getting nervous about something that may or may not even happen. So we need to be really careful. Go into it with a positive attitude, knowing that we're gonna be able to do what we need to do. Time management will still allow us to see 3 patients an hour with good assistance and good time management. And I'm gonna show you that a little bit later on exactly how we would break that down. We schedule patients on the hour. I loved how Christy was saying that yesterday. We have tried years ago to stagger the appointments, and you've got to do what's best for your office. But for us, we want our doctor to go in there, do his clinical care, and then be able to come out and do the hygiene checks, all right? If when we were staggering, that doctor is never gonna have an opportunity to actually be in hygiene and then go back to clinical, because he's going to be in a rotation of just seeing hygiene patients for a long period of time. So we do schedule on the hour, and we have to change the thinking that I'm the only one, because we are not. We have this amazing team of people that are gonna support us. You're not doing it alone. So, is Todd in here? Yay. So, Justin was mentioning, I love listening to Todd, and I'm not just saying that because he's here. If you've never had an opportunity to listen to Todd, then you've really missed out. Justin was talking yesterday, too, about, Todd speaking about likability. Such a big deal, and we use that in our office a lot. The other thing that we have used several years ago, Todd spoke on using the starburst analogy. So I called him and asked him if I could use it for this presentation. But what we started doing a couple of months ago is Justin and I went into all of our offices, and we worked with all of our assistants, and we were giving them a very similar analogy about what we're about to do ourselves. And I thank Todd for that, because it has been incredible. So thank you, Todd. I appreciate this. So how many people have their starburst? Have they made it back to the back of the room? Are they still going? Okay. Out of those in the very, very front, or that have theirs, then I think we're about halfway through at this point. What about that side of the room? Have you guys even gotten any yet? No? I should have done it earlier. My bad. But I don't want to not keep going. So I want you, out of these front sections, stand up if you have a pink starburst. Okay. Sit back down. How many of you have a yellow starburst? There you go. There's a whole lot less people that are gonna have a yellow starburst than a pink starburst. Pink starburst are the 47% most popular. I've never done so much dadgum research on starburst in all my life. But pink starbursts are 47% more favored. I thought that was interesting. Only 11% of people prefer yellow starburst. Even though, and the 6 people that I have here with me from my team, half of them all love yellow, which I think is hilarious. However, we schedule all of our patients like they're yellow starburst. We tell them, this is what you're going to do, this is where I'm going to stick you, and this is what you need. If I gave all of you that had a pink starburst, if I gave you a yellow one, would you have taken it? Yes, no? I have more prizes. I swear I give stuff away. Would you have actually taken it? So some yes, some no. Would you have eaten it? No. You're going to take it because, for the most part, we tend to say, sure, I'll take that. However, just because I took it does not mean I'm gonna eat it. More than likely, it's gonna sit on the counter, or it's gonna sit on the table, or I'll give it to my neighbor. I'll find someone else who does like the yellow one, and I'm gonna give it to them. When we schedule our patients in this middle time frame, that's exactly what we're doing. We're giving them something that they don't want. They're not going to show up, and then we're gonna sit back and scratch our head and wonder, well, why didn't they come? I'm so nice. You might be nice. They actually might really like you, but it wasn't convenient for them. So what we've done is we schedule our pink and red starburst from 7 to 9 and from 5 to 7. Those are our most important days, and Saturdays and Sundays. It's the most important time. Allow your patient, tell them. We're not gonna ask them what time or what day of the week they wanna come in. And I'm not gonna ask them what time of day they wanna come in. It drives me bananas. I have our assistants who'll say, I see that you're here at 11 o'clock today. Do you want to go ahead and come in at 11 o'clock again next time? Well, it was during the summertime whenever they weren't in school, like a teacher. A teacher's not going to come in December or January at 11 o'clock. She's going to be in her classroom, and we are going to be the very last thing on her mind, especially with everything else going on. We can't do that. So what we need to do is that we need to put those people where they want to be, which is at 7 and 8 a.m. in the morning and at 5 and 6 o'clock in the afternoon. Now, yellow starburst people, you picked that starburst. It's leaf light, but you picked it because that's what you want. If I have a patient who tells me, I really want to come in at 11 o'clock, okay, sure. They asked for that time, so give it to them. If they tell you that's what time they want to come in, they know their life, they know how things are going to work, so yes, accommodate that. But do not assume that that's what everyone wants. And be careful if you start to see that you don't have those morning appointments or those evening appointments filled up, it's because there's a little bit of manipulation going on in your schedule, and then you need to figure that out. Whenever we were going to all of our offices, someone actually mentioned that their roommate had this poster hanging up whenever they were in college. Never let anyone treat you like a yellow starburst. You are a pink starburst. And I thought it was absolutely hilarious, right? We talk about organizing our schedule, and it is, your schedule has to be the most important thing when you're working on your processes. Otherwise, you're gonna have a whole lot of people in your office, and they're not gonna be doing anything that they need to be doing. They're gonna be there at 7 o'clock, 8 o'clock in the morning, and if they're not scheduling appropriately, you're not gonna have anything on the schedule. They can't make phone calls at 7 a.m., so now you've just got people sitting around doing nothing. Make sure that we are being and we're open and available to our patients at convenient times. Don't you love it whenever you get those ads and stuff, and it's like, we are open conveniently for you from Monday through Thursday from 8 to 5. That's not convenient for anybody. We are open from 7 to 7, Monday through Friday, and 9 to 5 on Saturdays and Sundays. We know that that's the most convenient times for our patients. Saturdays and Sundays, if you have not opened up Saturdays and Sundays in your practice, you are killing yourself in your business. You gotta open up on Saturdays and Sundays. It's the busiest time of the year. People cannot take off work during the week. Make yourself available on Saturdays and Sundays. We also close our schedule from 1 to 4. Let me go back, sorry. We close our schedule from 1 to 4. We know that our patients are not going to be coming in during those times. We know our fall off rate. We know what time of day, what day of the week. We know those things because of the data that we have to actually support that. So we close down. You know what else this does is docs, it allows you to go in there. You can do clinical dentistry, and you're not gonna be interrupted to do exams. And in Texas, you're not gonna be interrupted to do anesthesia, because that's a pain in our butt. It's giving you that opportunity to do what you need to do uninterrupted. So then at 4 o'clock, when we open back up, or 3 o'clock, depending on our office, when we open back up, it's all hands on deck in hygiene. Those docs are available to do those exams. We're making the most out of that time. So this is the beginning of the day. As I was talking about color on the screen, this is the beginning of the day. Yeah, 7 o'clock or the 9 o'clock hour, this is on a Saturday. So the 7 o'clock or 9 o'clock hour doesn't really look that busy, but everything else looks pretty full. It's a nice looking day. There's the end. It falls off. You don't panic. When one hygienist looks at this, if they look at that at the beginning of the day and they're like, holy crap, you want me to do what? It's a lot of patients. The most that I've seen on a Saturday was 27 by myself. I had a great assistant. She was pre-polishing, post-polishing. She was amazing. It can be done though. But if you get so worried about what the beginning of the day looks like that you panic, you can't focus on what the rest of the day is going to look like when it ends up just looking like this. Your team has to be on board. And if they don't, it's going to be a bad deal. It's going to be sabotage. It will be sabotage to your schedule. It will be bad morale. They've got to be on board. You heard me say, I think people are our greatest resource. And if you love your people, and if you make them feel appreciated and loved, they are naturally going to take care of your patients because they are where they want to be. People who are forward thinkers, who want good patient care for your practice, that's what you want. Not those that are so timid to move forward. I will always believe you hire with a hell yes or with a hell no mentality, always. When I'm doing interviewing, if anything during that interview process makes me go, no, we're done. Because in about 60 days, that little is gonna be like nails on a chalkboard. It's gonna happen. And it's a whole lot easier to say no now than have to get rid of them in a couple of months. You cannot change those behaviors. Do not think you're gonna marry them and then change them. It doesn't happen. So don't try. Make sure that they've got a good philosophy. Make sure that you're talking to them and you know what they're doing. But do not try to think, I'll hire them and then they'll get better, because they're not going to. I am also telling you, do not fire everyone that's in your office if they give you a little kickback right now when you get started on all of this. They need to know the why. They need to know, as Christy was saying yesterday, they need to know what's going on and why you think this is going to be amazing. And when you support that idea, and whenever you support them with all of that knowledge, they can move forward. As a parent, if we tell our kids because I said so, it is immediately a no. I raised 3 of them, and I can assure you, if I ever used that, I was not going to get anywhere. But when I sat down with my kids and I would tell them, this is what's going on. This is why we need to do it this way. I guarantee you they were a whole lot better about doing what we needed to do as opposed to because I said so. Your team is the same way. If you expect and if you want them to move forward with you, then you have to bring them with you. Do not expect them to just fall in line because you're walking that direction. Show them why. Show them how. They are going to be on board with you if they understand why. What's that? Why do I start? I'm sorry. Who do I start with? Math's running up here. So I would, for me, I start with my hygiene team, okay? We have monthly meetings in every single one of our offices. We have our management team meeting once a month, where our office managers come in with like our management team and so forth, and we talk with them so that they understand what's going on. And then we expect those managers then to go into each of their offices, because we have 7 practices right now. So we expect them then to go into those offices and get those people on board. But when it comes to our hygienist, for me, I really plug in with my hygienist. I go into the offices and I talk to them at those office meetings, and it's like, hey, what questions do you have? Are you excited about this? And I always go into it with that mentality, not a, so guess what? We're about to change again. It's kind of funny that I tell people one of the things that will never change is that we do not stay the same. It's always we are constantly changing. They know that. So as long as they understand that there's always some change that can happen and that they get to be involved in that change, I think for me, it's starting with the hygienist, but it's maybe because the role that I'm in. And I also think it depends on what exactly that we're changing. What are we trying to implement? Because those people, whoever the most important part in that group, those are the ones that need to be the leaders in that change. Multiple hygiene providers is definitely possible with assistance. We have currently 32 hygienists in our organization, and we have assistants for every single one of them. It is gonna give us higher production. There's less overhead in salaries. You do have more appointments available. Your team is less stressed. And that may kind of seem a little bit odd, especially when we looked at the schedule a minute ago and you're thinking, how is it possible they would be less stressed? But let me ask you, when you go to work in the morning, what's more stressful? A filled day with lots of appointments or an empty schedule where you don't do anything all day? An empty schedule is way more stressful for lots of reasons. You got lots of bodies sitting around doing nothing, for one thing. But no one wants to go home at the end of the day and be like, oh, well, I sat on my butt all day long today. That's not what they want to do. They're going to be better when you've got more people being able to provide better care. We are very upfront if you've ever heard, when I do my hygiene interviews, we have an acquisitions manager that now does all of our pre-checking or whatever, I guess you would say. He brings in resumes to us, and then he sends the ones to me that he thinks, yes, would be a good fit for who we are. But I am very upfront when I make those phone calls. I look through the resume, I pick up the phone, and I say, hi, my name is Mandy. I'm with 7 to 7 Dental, and I'm calling because I received your resume for interest in a hygiene position. Is that still something that you're looking for? Yes, absolutely. Fantastic. One of the things that I want to make sure and let you know is that we are here to take care of our patients in days and hours which meet their needs. Therefore, we see patients from 7 a.m. to 7 p.m. Monday through Friday, and from 9 to 5 on Saturdays and Sundays. Do you have any conflict with these days or these hours? And then I just shut up and I listen. I listen for the pause, and whenever I hear that's an automatic hell no. Because if there's a pause now, there's gonna be a pause when I hired them. If they tell me they don't wanna work the weekends and I hire them, I'm giving them permission that they don't have to work weekends. Because I was upfront with it, they were upfront with it, and then I went ahead and I hired them. Clear expectations. They knew what I wanted. So make sure that you are upfront with your hours and your days. When I bring them in, I give them a scenario of what we do, how we do it. And then I kind of ask them what are they thinking. Not because I want to see if they're right or wrong, and I don't even tell them it's right or wrong. I give them an opportunity to just pick something. But if they don't do it like we do it, I don't want them to have to pretend, because at some point, they're going to do what they want to do. It's just a natural reaction. And unfortunately, what will also happen is some of those other like-minded people that you've already hired, they're going to follow in suit with that bad behavior. Pick right. Make sure you've got the right people in place. Allow them to be providers of care. Give them autonomy. We have such amazing doctor-hygienist relationships. We talk with our doctors, we talk with our hygienists about partnering together. So whenever that patient comes in, they know they've got someone who is really supporting this other provider. It is so important that your doctors and your hygienists are really talking to each other so that they can provide the best care. And whenever your hygienists feel like that they are true providers of care, that's how they're going to behave. So give them the autonomy and be selfish. It's a big deal. When I hire a hygienist, I tell them off the bat, you cannot temp in other places. You're ours. I want the best of you, not the rest of you. And we are providing 401k. We are providing their vacation or their ETO. We are providing them medical benefits, dental benefits. I'm selfish. I don't want you somewhere else. But the other problem is if they're working somewhere else and that place has bad habits, they're gonna bring those bad habits into your office. And you do not want that. So make them your own. Make sure that whenever you're looking at hygiene assistants, you need to understand that their sole responsibility is in hygiene. Now, our assistants, it's working a little bit different in the sense that we have all of our assistants that can do all types of care. It's one of the things that we're working on right now. And it's so amazing as we change this, and as you were asking me earlier about, who do you go to first? As we started rolling out this new way of our assistants seeing patients and how they're working every day, we thought we might get a little bit of kickback. They were so excited. We had people actually asking us why we had not already been doing this. So what happens is we have assistants, and they can all do everything. But in the morning time, they are told, you are in hygiene and you are in clinical. But you're an assistant, and this is how we provide care. They actually get to appreciate each other too for the roles that they each have and how busy and how much is actually going on. But it's a great way. If someone calls in sick, I'm not having to say, I gotta find a hygiene assistant. I gotta find a clinical assistant. Actually, I just need an assistant. But that being said, make sure that the commitment is in hygiene. If they are working in hygiene, then doc, you get same-day dentistry. That does not mean that you get to pull an assistant from hygiene, because their job for that day is taking care of patients in our hygiene department. We have really built some great relationships with our hygiene, or like our assisting schools and things like that. There's also high schools with vocational training and things like that, and you can do that. But starting with new assistants and then molding them to what you want is a really great way to getting assistance. And I definitely highly encourage that. When it comes to clear expectations, this goes back to the start with why. You need to share your philosophy, and you've got to share your plans with your team. You cannot expect them to be part of the growth if you have not shown them and told them where you want to be. Bring them with you. Do not tell them this is where you're going to go. Show them what you want. Show them where you're going to go. That's a big, big part of it. When you set those clear expectations, they know they want to be there because they can see this big picture of things. But if all you do is tell them, they don't have that understanding. Our expectations are that we want our hygienists to see 2 patients an hour. Yes, sometimes it happens that we have 3. And we just open it up a little bit more. This is actually how we see our patients. So when those 2 patients come in, as a hygienist, I get a patient and my assistant gets a patient. I bring my patient back, I seat them, I do a quick run of their medical history, I get their blood pressure, and then I get to work, okay? My assistant brings that patient back, gets the med history, goes ahead, gets the blood pressure, they take x-rays, and then they're gonna let the doc know that there's gonna be an exam. In the meantime, I'm finishing my prophy, or whatever type of care I'm providing, and then I'm gonna switch with my assistant. I'm gonna go over there, and I'm going to be taking care of that patient who now has their x-rays, and then my assistant's gonna come in and do the x-rays for the patient that I just finished with. Tell me, hygienist, how much time, and I have it written here, but how much time does it take for you to do a healthy prophy? Just a prophy. Say it louder. 15 to 20 minutes. Make sure that you see me afterwards and you can have a goodie bag. So 15 to 20 minutes. If that's the case, what are we doing with the other 40 to 45 minutes? We can see more patients whenever we have people in place to do the things that's within their scope of practice. I don't need to sit in there and do an exam with the doc because I have someone who's doing that. The treatment coordinators are doing that. I don't need to take x-rays. My assistant is much better at taking x-rays than I am. They can dance circles around me. Allow people to do what they can do, and I promise you, everyone is going to feel better about their day. Come on. I think sometimes it's one of those things that as we get up here and we're talking about all of this stuff, that it seems like all of our stuff is together, like we've got our shit together. Stuff happens. It was about 3 months ago, I guess it was, we were short treatment coordinators. I think every single one of us could raise our hand in this room on how hard it is to find people right now.
Hello.
Yes. Oh, hey. Hi.
Hey, Mandy, I just have a quick question.
Please.
So you were showing us how you do it with the assisted hygiene.
Yes.
When the hygienist, if they only have one appointment scheduled, do you still have the assistants do the same thing for you?
Yes.
Okay.
And when you say that too, this is something that's really important. I had a hygienist years ago that she was fantastic. She is fantastic. She no longer works for us, but she is fantastic. She would have, we were just opening up a practice, and so she had an hour. What was happening is that she would start using an entire hour. She was like, well, I've got all this time. Well, the problem is whenever, as the schedule was starting to fill, she kind of fell out of practice on exactly how to take care of an efficient appointment. And so she was so used to actually just doing hour appointments, it was so hard for her to go back into how we do things. So that's the reason why we keep it just like what we do, no matter if I've got 1 appointment or 3 appointments. But it also is that continuity of just ensuring that that hygienist also feels supported. If a doc only has 1 filling, or if he's only doing, and I know it's different, but if they're only doing a very small procedure, they're still gonna have that assistant that's going to be there to do their parts, right? And to me, it's the same thing. It's making sure that we've got everything in place and we're consistent all the time. So as I was talking about the transparency, we were short on treatment coordinators. And we had this little bit of a lull. It was weird. Even the hygienist at this one office had told me, they were like, oh my gosh, it feels like the patients are falling off even more than usual. And I was like, okay, are we ready to open the floodgates again? Yes. All right, goes back to getting on board, full conversations. We're all bringing, tell me why you guys are ready to do this. Let's talk about what this means. And so we did. And guess what? Everyone was showing up. 9, hour after hour. It was like, holy crap. 13 years, we have not had this happen, where it was just hour after hour after hour. We had the assistants, we had the hygienist, but we didn't have the treatment coordinators. And it's about all of the processes put into place. We had one person. I am very proud to be, as I was telling you earlier, being in Justin's office. He supports people being able to make those decisions, and he lets people be owners and be managers in their practice. This specific hygienist had gone to her office manager and told her, I'm exhausted. We've got a problem. She didn't call me, and I don't micromanage their schedule. I called them and I was like, I'm so excited. You guys are doing amazing. I took 2 of our hygienists to Indianapolis for under one roof. And while I had them up there and I'm having these conversations with them, I also get a resignation letter from one of the other hygienists in their office because they were exhausted. That's when we found out we were short treatment coordinators. We didn't know that there was one treatment coordinator that was trying to do 9 appointments plus clinical and limited appointments. It's impossible. We were running behind hour after hour after hour, and they did not feel supported. Do not think that because you've got things put in place, make sure that you're following through, though, to make sure you know what's going on. And especially if you've got multiple practices, you really need to make sure you know what's going on in every single office. Not micromanaging it, but you definitely need to be aware. Make sure you know what's going on. I'm not even sure how that one got into this, but when we go back to this is the exact same thing as the one before when it comes to how we actually do things. X-rays, prophy x-rays exam, it doesn't really matter. As a hygienist, I can do a prophy without x-rays. Technically, the only thing that I really don't want to do, I don't want to do a new patient without x-rays. But if I need to, I can at least go in there, introduce myself, sit, talk, take a picture of what things look like, at least visually and clinically, and then my assistant can come in and do some x-rays. But it's not hard for me to go in and take a probe and PSR to find out, it's 8mm pockets. This is a perios patient. I don't need x-rays to show me that. The financial benefits of having a hygienist and assistant are huge. In San Antonio, the average hygienist is ranging anywhere from $32 to $35 an hour, okay? We pay our hygienist per patient and per hour. And when we tell our hygienist, whenever I'm doing the interview process, and I tell them we pay you $10 an hour and then $25 per patient, but you average about 1.6 patients per hour. That's huge. And then I actually show them the math so that they can actually see that. That's huge. That's more money than they're going to make anywhere else. As you're the practice owner, you need to look at what does this look like for your bottom line, honestly. If a hygienist, because on Saturdays and Sundays we pay our hygienists a flat $45 an hour, it's what they want to do. It's one of those things that we let them do. It's another conversation another day. But our hygienist makes $45 an hour. If they work 8 hours, it's $360. The assistant makes $15 an hour at 8 hours, and we have 2 of them. It's $240. So the whole thing is $600. Okay? A hygienist without an assistant to do the same type of schedule where I need 3 hygienists, it's going to cost me over $1,000. Get a good hygienist that's going to have the same type of philosophy of care that you have, or get a couple of them, support that with some amazing assistants, and you're going to have a phenomenal team. You don't need more hygienists who are just not able to do more work. This is going to actually allow them to be happier at the end of the day too. They're going to feel like real providers of care. I hear this all the time. We've tried it. It didn't work for us. It probably didn't work for you. Yes.
Would you explain your compensation package for hygienists? Do you give them an hourly wage plus per patient, or is it one or the other?
No, we do. That's a great question. We do $10 an hour plus $25 per patient is the way that we do it. So if they work, and I'm going to do real simple math here because that's the way my brain has to work. If they work a 10-hour day, okay, because we're open 7 to 7 with that longer lunch. They work a 10-hour day. They're going to get $10 an hour for those 10 hours, so they're at $100. However, if they saw 15 patients, then they're looking at, what is that, 300, 27? Okay, let's say 16 patients. That's easier for me too. 300. So then we've got 300 plus the 100. That's $400 for the day. So they averaged $40 an hour. Does that make sense? Okay. That's the way that we do it. Yes. I'm sorry? No, the weekend works completely different. The weekend, when we first presented this to all of our hygienists, they actually asked if they could have a flat rate. The question was, like whenever I was showing the $45 an hour, on the weekends, our hygienists have elected that they wanted just a flat $45 an hour rate. And honestly, I love that because I know they see more patients than what they are making. But that's still what they chose because they wanted just that constant rate. And it was our compromise in saying, sure, you can have that. But really, they are shorting themselves because they see more patients on the weekend than they see during the week anyway. But that's what they've elected to do. So on Saturday and Sunday, they only make $45 an hour. It's not an additional rate. Any other questions about that?
How do you handle scaling and root planing appointments?
They're a patient. I don't know where that's coming from. I'm sorry. Okay. It's just a patient. So in the state of Texas, hygienists are not licensed to give anesthesia. So my doc still has to go in. They're giving anesthetic with the assistant while I'm working maybe on a prophy. I'm doing that prophy for 15 to 20 minutes while my patient's getting numb. So Texas works a little bit different in that aspect. Ask me completely, once things change. The other thing that we do is that we prefer our scaling and root planings in the middle of the day where those yellow appointments are. And we tell our patients, I want to see you at this time for your gum treatment or for your periodontal treatment, not your deep cleaning, not your scaling and root planing, but for this treatment. It puts a little more value on it, that it's not just a cleaning, but it also helps that patient to understand I need a little bit more time, and I'm not putting them in that prime time appointment in the morning and the afternoons, and we do not scale and root plane on weekends. That's a no-no. Those are prime time appointments, and I do not want to be in an appointment that I'm going to have to be committed to for longer. So that's the way that we do that. But they still get compensated the same way because it's a patient. But if you are this person that you said, we tried it before, but it just doesn't work for us, more than likely the reason why it didn't work for you is because you didn't have these processes in place. And not only did you not have these processes in place, but the conversations were not had for you to be set up for success. You didn't set your people up for success.
You have a question?
Yes.
Can you explain a little bit deeper how you would, if a patient were to come in as a new patient and they are diagnosed with SRP, how y'all would present that to a patient with verbiage, treatment planning, and so on?
Absolutely. New patient comes in, and the patient is going to need scaling and root planning. I go ahead while I still have this patient laid back. I let them know, you know what, Jane, your gums aren't real healthy, but actually I'll even back up even further. My assistant does all of my perio charting with me. And I tell the patient, I'm going to go ahead and I'm going to be calling out a whole lot of 1, 2, 3s, ABCs, because I'm going to go ahead and make sure all the charting's done and stuff like that too. You're going to hear me say a bunch of numbers. 1 to 3 would indicate things are good and healthy. If you hear me say 4, 4 is more of an indication that there's some inflammation going on, not truly necessarily infection. If you hear me say 5 and above, it's a conversation we're going to have when we get finished with all of this. But please let me know if you have any questions at the end of this or at the end of my counting. I go ahead, I go through an iPerio chart, I mark all the bleeding and all of that stuff too. And then before I even set the patient up, I take an intraoral photograph of the lingual calculus, because that's our favorite place to have to clean anyway. I go ahead, I take a picture of that. I go ahead and knock some of that calculus off. I take another intraoral photograph of what actually I just did. And then I polish the front of their teeth and I set them up. The reason why I do all of that is because I'm not going to be able to scale and root plane them today. But they still expect that they're going to leave here with minty, gritty taste. That's what they think they're going to have. When I set them up, I let them know, Jane, I want to show you a couple things. You heard me say all those numbers. You heard me calling out all those 5s and 6s and I'm not saying furcation involvement, mobility, stuff like that. That's an entirely different level of perio situation. But for those patients that are kind of like your bread and butter perio type stuff, That's those people that I polish those facial surfaces. And whenever I show them that intraoral photograph on the back of those front teeth, and I'm like, do you see what was actually on here? Now do you see what's not there? That's the same kind of stuff that's going on up underneath your gums. There is infection present underneath where you can't see, and we need to get rid of the infection. So I need to bring you back, and I need to do a gum treatment. I need to ensure that you're numb so that I can remove all of that infection from underneath the gums so that we can help get you healthier. What I did for you today is not therapeutic at all. It is purely cosmetic. But I know, just like I would want, you want that nice, minty, gritty feeling. And I want you to be able to have that, at least until when you come in and we get you healthy. We let our treatment coordinator know that there's going to be treatment that needs to be done. The doctor will have come in at this point and give it his sign, that yes, this is exactly what we need to do since we can't truly diagnose. And then they treatment plan it. Our treatment planners actually go in and our treatment coordinators go in and they actually present that treatment. We do not as hygienists present the perio treatment or any type of financial treatment. We allow the people who are best at that to do that. Does that answer your question? You're welcome. So I want you to think about making it work, knowing that you have to give it a chance. You need to set this up on exactly how to do it. It's really important. When you take away things from what's going on from here, please make sure, like I said, don't go home. A few years ago, I had someone who came to me, they called me actually, after they left the conference, and all their hygienists had quit. And I was like, well, what happened? And he said, well, I went back to the office. I told them that we were going to start seeing 3 scheduled patients an hour. And so he continues, and I was like, well, no kidding, they quit. I would have quit too. That's not good. So make sure that you are going into this with plans. Make sure you're going into it with good expectations. Make sure that you're going into it talking to your teams with a plan in place so that you've got good processes. It's so important. I appreciate my team that's here with us today. We all did wear pink today because I'm a big proponent. You got to schedule pink. Not because October is coming up and it's Breast Cancer Awareness Month. That's not why we did this. But I have t-shirts too that I want you, when you leave here,
Mandy?
to go. Yes.
We have a question.
Yep.
For that first appointment, when you said you scale the lower anteriors,
Yep.
do you bill that out as a pro fee or just exam, new patient exam?
That is a phenomenal question, and I'm so glad that you asked that. On that ledger, we do not bill for a pro fee because a pro fee by definition is removing everything supergingivally in the presence of healthy tissue, and you didn't do that. And when you knowingly bill out that pro fee, and you know that you're going to have to do a scaling, that's insurance fraud. We bill an exam, x-rays, and that's it. We do not do the full mount debridement. We don't do that either because I was able to, because I've had people who have asked me that too, and they're like, well, technically, you're kind of doing an FMD, but the problem is that I can look at what needs to be done. A full mount debridement is us having to remove everything so we can figure out what they need. Be very careful. Only bill what you do. And we have an internal code that, Dentrix will let you put in a bunch of extra codes. So we have internal codes that for that first appointment, we call it our alternative treatment to periodontal prophylaxis. It's ATPPX1, that we will do that one time. If the patient declines perio treatment, we will bring them back in 6 months. But we did not bill out for any type of hygiene care. But when they come back in 6 months, we've scheduled them for what we call that ATPPX2. And again, remember, this is our internal code just to help track things and schedule them appropriately. But whenever they come in for that second appointment, and if they still continue to decline treatment, the way that I explain to that patient is, you know what? This is something that you really need to have done, and it is important enough for you to get it done that I'm going to go ahead and refer you. because our relationship is not where it needs to be for you to move forward to get healthier, and I want that for you, and so I'm gonna go ahead and refer you out. If you refer them to a periodontist, I guarantee they're gonna come back, because it's gonna be double the price too. Sorry if there are any periodontists in here, but it is true. Yes.
Got another.
Okay, so you said that y'all were shut down for 4 hours from 1 to 4, right?
Uh-huh.
Hygiene department.
Uh-huh.
And you kind of assign certain assistants, your doc, your hygiene, and back and forth like that?
Yes.
So my question is, what do you do with the assistant during the 4 hours that their hygiene's closed down?
Great question. There's recare that can be done, okay? There's just normal day-to-day stuff. But the other thing is remember what we're also doing is we're doing additional clinical care during that time too. So for those 3-4 hours, those assistants, because they can do anything, those assistants can go over to clinical and help out. Because we're actually doing more clinical care during that time. But at the end of the day, we also have those patients or the assistants that have been helping over in clinical throughout the day. Now they can come over to hygiene at the end of the day. Yep. Okay.
Thank you. So, Mandy, I've got two parts to my question.
Okay.
The first is when you are hiring people, particularly hygienists, and, well, in general, the dental assistants and hygiene assistants as well, you guys telling them we're working weekends, you're telling them hours, right?
Yes.
Are you requiring them to give you the commitment for all weekends, or you compromise at that level with them that, okay, it's alternate weekends or 2 weekends a month or something like that? That's the first part of the question.
Okay.
And the second is when they commit you, and for any reason, if they change their commitment during the course, how do you respond to that?
And when you're saying change the commitment, like all of a sudden they don't want to work weekends anymore?
Exactly.
They get to go find a new job.
Okay, perfect. The first part, please.
So let's go back to the first part, right? So the very first question is whenever I'm laying all this information out. We have 7 offices right now, about to open up our 8th one on December the 1st. I lay those expectations out that each office is responsible for their schedule. So what I've most recently done is I had all of the offices send me their schedule, and then I was like, this is what I have a need for. And I hire for a schedule. But what I also do is whenever this person is hired for this schedule, I am very direct in letting them know everyone in this company works weekends. Everyone. It might mean that you work Sunday, Monday, Thursday, because I've got that schedule specifically that I just hired for. Sunday, Monday, Thursday. It might be that you work every other weekend. And if you work every other weekend, that means you get every other weekend off. However, some people would prefer to just work every single Saturday, knowing that they have every single Sunday off. So whenever I'm hiring, as I hired 3 hygienists this past week. Whenever I'm hiring those people and I'm laying these schedules out and I've got these many offices and they're all pretty close to each other, and I'm like, this is actually what we have a need for right now. This one's gonna be this one. You'll be working every single Sunday. This one would be every single Saturday. This one's every other weekend. But it basically ends up going back to the level of which office that it's at. But every single employee has to work weekends. Everyone. There's no, and to even go back to the second part of that question, if their life situation changes, I let them know, I understand that this is not the place for you right now in this time and season of your life. That does not mean it won't be forever, or it will be forever. If things change, please know you can come back. But for where we are right now, I am not going to compromise everyone else in the office just because this person doesn't want to hold up their end of the deal anymore. So, any other questions, please make sure, oh, okay.
I have a question.
Yes.
Yesterday, John was talking about downplaying SRPs terminology-wise. How do we still create that urgency for patients to return every 3 months for perio maintenance?
I think that this is kind of one of those time-old questions too, that patients at the end of the day, they want their free cleaning, right? They don't understand, which is why we don't call them deep cleanings in our office. We call them gum treatment or perio treatment. You know, we have these scripts put together so that we can do this. And then whenever they come back, so we can ensure that everything got healthier, we use a script that tells them, you know, you're gonna be using, we give them chlorhexidine. So you're gonna be using this PerioGuard and it's gonna cause all this staining on your teeth. You're gonna come back in 6 weeks, I'm gonna get it all off. Those 3-month appointments, the way that I emphasize the reason why this is so important, you've had an infection, this is where we are. It can actually act back up again, right? I don't try to get too clinical, but I do let them know there's a reason we need to see them every 3 months. This infection can be addressed if we see it when it needs to be taken care of before it gets really bad, we can address it. And I know that they do not want to do all of this treatment again, so I need them to come back in every 3 months so that we can address it if it happens in a specific spot as opposed to generalized. Does that answer your question? Okay. If there are any other questions, I am most certainly available. I'll be here obviously for the rest of the day, but I don't want to take up any more time from Dr. Weidler. Okay, thank you guys so very much. I appreciate it.